Hello, welcome to Telehealth Basics. My name is Paul Fredolino, and I'm a professor of social work at Michigan State University. With a grant from the Michigan Health Endowment Fund, my colleagues and I created this series of 8 videos that provide basic information about telehealth services. Sometimes also called telemedicine, telehealth lets us connect with our doctors and healthcare providers in ways that may be more convenient than an in-person office visit. Before jumping into the content, I need to point out 2 important messages. First, it is important to say that the content of these presentations about telehealth is for informational purposes only and not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Second, the Virtual Connections project that developed these videos has been supported by the Michigan Health Endowment Fund. The videos in this series cover 8 topics related to telehealth. Part 1 begins with some definitions and examples of telehealth, and describes some reasons to learn about it and potentially to use one or more features of telehealth. Part 2 goes into more detail about the different features or tools available in telehealth. Part 3 will focus on patient portals, also called electronic medical records, that are one of the most useful tools. Part 4 will cover financial fraud and scam prevention, starting with why we cover this in our series about telehealth. In Part 5, we will move on to what you can expect to happen in a telehealth visit. There we will cover the topics that the healthcare provider should cover with you. In Parts 6 and 7, we will review the services and resources available through telehealth related to mental health and substance use issues. Finally, in Part 8, we will review the steps to take to prepare for a telehealth visit. Because there has been a lot of recent interest in artificial intelligence, or AI, we have added some information about what it is, what it can help us with, and why we have to be careful with it. We have been helped in preparing these videos by people like you who used earlier versions and gave us feedback. Their involvement has made the videos better, and we cannot thank them enough for the part that they played in the process. It has truly been a community effort, and as you begin this series, we welcome you to this community. After you finish each video, we hope that you will tell us what you found most valuable and how we can make your experience even better. Your feedback is essential to keeping the videos fresh and useful for everyone. We invite you to become part of this community, working together to build a great resource for everyone. Now let's begin the first video. We hope that you will find the information helpful and informative.
Hello, and welcome to Telehealth Basics. My name is Katherine Clemens, and I am part of the team from Michigan State University presenting this series of videos that cover various aspects of what is generally called telehealth. This is part 1, titled, What is Telehealth? We are going to deliver some basic information about telehealth in this video. In this first video, I'm going to cover 5 main topics. I'll start with the definition of telehealth, what it is, and what other names are used to describe it. We'll also cover some reasons for learning about telehealth and why we should consider using telehealth. Telehealth is not the right answer for every medical condition, so we will describe the conditions that can be addressed by telehealth. We will end with a note about other uses of telehealth that will be covered in the next video. So, to begin, what is telehealth? Telehealth is the use of electronic information and telecommunication technologies, like computers, smartphones, and videos, to support long-distance clinical care, patient and professional health-related education, public health, and health administration. You might also have heard the word telemedicine. Telemedicine has a narrower definition than telehealth. It covers remote clinical services, while telehealth also involves non-clinical services like health-related training and education. Other terms like telehealth that you might hear are telecare, e-health for electronic health, and m-health for mobile health. Because telehealth includes more types of service, this is the term we use in these videos. So, why should we learn about telehealth? There are several reasons. During and after the COVID-19 pandemic, telehealth use expanded, and all indications are that telehealth will continue to be used in the future. Also, telehealth is available in most hospitals and clinics throughout Michigan and other states. Therefore, there's a good chance a family member, friend, or neighbor has used telehealth services or will do so soon. The more you know about it, the more supportive you can be. If you have not already used telehealth, these services may well be in your future. Learning about telehealth now will help you to be prepared to get the most out of these services. By learning with this video instruction, you will know how to use telehealth when you need it and how to use it in a way that is most helpful to you. Also, you will be ready to support a family member or friend should they need telehealth services. There are several good reasons to choose a telehealth option instead of an office visit. These include ease of scheduling. Telehealth visits can often be scheduled much sooner than an office visit. Other reasons are listed on this slide and include meeting with your provider from your own home without having to travel, not having to travel when you don't feel well or when the weather is bad, not wanting to expose others to whatever is making you sick, and being able to have a caregiver or family member easily join the visit through technology. Telehealth is not the right choice for all conditions, but there are many conditions that can be addressed by telehealth. Here are some of the examples of conditions where telehealth services can be used in assessment and treatment. We see conditions such as allergies and asthma, low back pain, diabetes, mental illness or behavioral health, dermatology, and more. Now we'd like to show you a brief video that describes what telehealth is all about. It is from a hospital in Australia. Because of its vast size and low population, Australia has been one of the pioneers in developing telehealth. This video addresses some questions that you may have about it.
Put simply, telehealth is the delivery of a health service across a distance. So a good example of telehealth may be if a patient has a video conference appointment from their home or from a regional hospital directly to a specialist at a main city hospital. Telehealth can be also delivered by using the simple telephone, also by sharing information. For example, sending a digital image by email is another good example of telehealth. Often we think of telehealth as a method of supporting people in faraway places. However, telehealth is just as useful for people who live in city environments. Telehealth is not designed to prevent all travel to a specialist. While telehealth can be extremely useful for a range of appointments, such as follow-up appointments, the choice of whether to provide service in person or by telehealth should be based on the clinical requirements and the purpose of the consultation.
Research shows that the assessments and diagnostics performed via telerehabilitation are equivalent to in-person services, and the treatment outcomes that you can achieve via technology are not inferior to traditional services.
Our research debunks this myth by showing that the virtual delivery of healthcare is experienced differently by clinicians than in-person delivery. Importantly, telehealth requires adaptation work and the learning of new competencies by clinicians, and changes the dynamics and interaction between those involved in delivering health services.
Well, contrary to what most people expect, older people really do like this form of conversation. Quite apart from the fact that they don't have to travel and get tired going to see the specialist, they find this a really comfortable way of interacting with a health professional.
When you have a well-coordinated service between two sites, then we've found that actually you take less time to manage patients. Patients need less sessions, and the duration of time that you're seeing patients for a session is less. And this actually results in more time efficiencies for the patient and also cost savings for the health service and overall more consumer and clinician satisfaction.
You no longer require expensive hardware to participate in a telehealth consultation. In many cases, a smartphone with a reasonable camera and internet connection can be used for a video consultation or to share clinical information. Of the millions of outpatient appointments being reported throughout major hospitals every year, it's important to consider the potential of telehealth as an alternative method of engaging with patients.
So what are the key ideas to take away from this first video? If you haven't used telehealth services yet, they are likely in your future. Most hospitals and many doctors provide telehealth services. Telehealth is used for a wide range of health conditions. A relative or friend has likely used telehealth or will do so soon, so knowing about it is helpful. At the end of each video, we have prepared a learning check to help you see some of what you have already learned. You don't have to turn in your answers, just think about them, and then we'll look at the next slide for the correct answers. Here we go. For the first video, we have 2 true or false questions. So for each of these, just think about whether the statement is true or false. First, a trusted relative or friend can easily join me in person or through technology during a telehealth visit to hear recommendations from my health team. Based on what you saw in this video, would you say this is true or false? Second, how about this statement? Telehealth is only available in large cities. Based on what you saw in this video, would you say this is true or false? Okay, are you ready for the answers? The first statement is true. You may invite someone to join your telehealth visit if you choose, but we mentioned earlier you have to check with your provider to make sure their system permits it and that the provider approves this type of visit. As for the second statement, that telehealth is only available in large cities, it is false. Telehealth is widely used across cities and rural areas. As we come to the end of this first video, we want you to know that we value your feedback. These videos have been modified over time thanks to comments from viewers like you. They have generously shared their feedback, helping us to improve the content. We believe in the power of teaching together and learning with and from one another. Let us hear your thoughts and suggestions for this video by using the comment feature below. We encourage your feedback on each of the videos in the telehealth learning series, and we look for your comments on the remaining videos as well as this one. Thank you.